This is the Oxford Joerns Up. This piece of equipment is used to help a patient transfer from A to B. It is not designed for transport, it is designed just for transfer from A to B. This piece of equipment does have these flaps that you can place down, which the patient can sit on when they're moving from bed to chair, or chair to bed, or chair to commode, wherever it is that they're going. They do still need to be able to weight bear enough to stand independently, but they don't need to be able to necessarily weight bear for as long as the other types of stand aids. A person does need to be able to hold on and use their upper body strength as well to help them stand. The safe working load for this piece of equipment is 200 kilograms. So with the Joerns Up, I'm just going to push it in towards the patient, open the legs around the chair, and ask the patient to put their feet on the foot plate. Just pushing it in as far as I can. With this piece of equipment, as with the other patient turners, with this piece of equipment we are applying the brakes before we use it, so it's really important to have the brakes on when the patient is transferring. You just ask the patient to hold on to the handles here. You don't need to counterbalance, but I'm in my fab stance. I'm going to say ready, steady, stand. Once the patient has stood, you can then come around the side and place the paddles down and encourage them to sit down onto the paddles. So with this piece of equipment, a patient only needs to be able to stand for a few seconds, but they do need to have enough lower limb and upper limb strength to stand for the time it takes to put those paddles down. So in my fab stance, I'm just slowly, gently moving the patient out from the chair and over towards the bed. So pushing the patient towards the bed then, going in as far as we can before we touch the bed, and then putting the brakes on, asking the patient to stand, and you're ready, and then just moving the paddles out of the way, like so, and then ready, steady, and sitting down in bed. Good, and then I take the brakes off and encourage the patient to just lift their feet up off the foot plate as I remove it from them.